Hello, and welcome to yet another episode in Healthcare Awareness Programs from Critical Care Unified Private Limited. I am Rajiv Mathur, Executive Chairman. Today, we will talk about a very important aspect in patient care and management, the quality of which can have a major impact on the outcome, and that is nursing. We are fortunate that on this International Nurses Day, we have with us one of the most professional and respected leaders in the nursing profession, Srimati Usha Prabhakar. Armed with a string of graduate and postgraduate qualifications in nursing, sociology, psychology, hospital administration, including a doctorate in digital medical records related to nursing and health informatics, Usha ji has had wide experience of working in renowned hospitals of India and the United Kingdom. She also pioneered nursing care in the out-of-hospital setting, looking after patients in their homes. She is currently employed at Apollo Hospitals as the Regional Nursing Director responsible for the Telangana sector. Welcome, Srimati Usha Prabhakar. Start with why do we celebrate this International Nurses Day? Can you throw some light on that, please?
Indeed, it's my privilege and honor to interact with you, Rajiv ji, just before the International Nurses Day. We remember Nurses Day with a torch, a lady behind it, and that lady is immortal, none other than Florence Nightingale. We celebrate every year her birthday on May 12th internationally at a global level. And this year's theme for International Nurses Day is Our Nurses, Our Future. As we always recognize and say in healthcare, the heart and soul are the nurses. They are the backbone of the healthcare industry, and they play a pivotal role, in fact, a very critical role in shaping up the healthcare future. And they play a significant role in providing health to all and health for well-being of the patients, providing a care and compassionate care, and to advocate for the needs of their patients.
Nursing has evolved and the role it plays today in management of a patient.
Right. In before the modernization, the nursing was only, opted by our the monks and nuns. But in modern era, it is a very, very indeed recognized profession where there will be a entry-level examination, screening, and then going for the registered nursing course, which is RN and RM, whether it is diploma or graduation. And before, there was no standardization in providing the standardizing in care. Hence, there will be a human errors. But now we follow international protocols, and there are Joint Commission and NABH guidelines to follow in healthcare industry. So it's nowadays, it's a modern nursing means it's evidence-based practices which we follow, protocol-led, clinical governance in place, strategic planning is there, and a huge investment on trainings. That is the change. Could you just sort of give a landscape of what the opportunities are, what the challenges are, what the occupational hazards may be in a professional like this? Because at times it can get to be a very stressful profession as well when you're looking after a critical patient, for instance. Yeah. So love to hear your views on this. Right. I'll start with the challenges and we'll go with the good one. The challenges remains for the every healthcare organization, all the corporates, whether it is in government sector or home care, entire, global level, and in fact, in Indian national level, we are facing the nurses moving to abroad So 1 or 2 years of experience in a good corporate setup, whether are in government organizations, they are moving to abroad, and we are not able to generate that many nurses with the colleges which are available in our country. Hence, required more nursing colleges to generate more number of nurses to address the challenge. Number two is nurses burnout. The work stress, the lifestyle where there is imbalance between a work-life balance, going for a holidays, or availing their offs, regular offs are lacking. And hence the nurses are moving out away from the profession. But nevertheless, the opportunities are at very, very high level. The opportunities now, during the pandemic, we have seen and witnessed entire global level and a national level that they are the front foot employees, whether it is vaccination, whether it is caring in the hospital or at home or in extended care homes. The nurses played a very, very major and a crucial role in healthcare and shaping up in a futuristic way. So the nurses got a lot of opportunities, and telehealth is also nowadays is recognized. So counseling, educating the patients at the community level, education is also been recognized in public health sector, where the nurses are playing in a health and well-being role is also recognized. Nurses can opt various roles. EICU is also there. So once they are graduated and got the experience, they can go for various specializations, as well as they can work in hospitals and at home care or telehealth or EICU.
The role of a nurse within the hospital as compared to that outside the hospital, because in the hospital, there's all the infrastructure, right, to support and all of that. And outside the hospital, a lot is dependent on the nurse. A lot more is dependent on the nurse, although there are areas of technology which support that. But how do you see that evolution and in terms of the value add that a nurse provides to the patient as well as to the treating doctors or the team that's attending on the patient?
Hospital, the challenges remains where a lot of people are there to address it. So the very first is nurse-led protocols and evidence-based practices where the nurses practice, and early recognition of the deterioration or the well-being of the patients, where nurses do recognize and escalate and provide the best of the gold standard care. But and it's easy because there are nurses where senior nurses with well experienced specialized nurses also along with the doctors available, whereas once the patient get discharged at home, when somebody have to look after them, so where their home care nurse role plays a major role in providing in continuation of the care from the hospital, where they have to follow protocols, policies, and then the prescription have to be followed, daily monitoring have to be in place, evidence-based practices, skills have to be top-notch, because they are the one patient and one nurse who's looking after. So hence early recognition and escalations are plays a major role, and nurse play a role where she can be making a decisions and governing the progress of the patient and monitoring, real-time monitoring and sharing with the treating doctors and monitoring the outcomes of the patient. I think it's where the nurses are playing a tremendous role on monitoring, sharing the reports and counseling, and also educating not only the patient and entire patient family in the journey of health and well-being, documenting it, and the doctors sitting very far can monitor and see and provide the advices when and then required. That's where the technology played a major role. And families sitting very far in abroad, they also at one glance, they can see their near and dear ones, parents' well-being, they can see. So that's played a very, very innovation of the technology backup in continuation of the hospital at home care.
And I think absolutely right. And I think clearly this has to come through in terms of education of nurses, grooming of nurses, of the importance and how their role in the whole sort of value chain of treating a patient is changing over a period of time. It's getting more and more important, more and more decision making, like you said. So, keeping all that in view, how do you see the future of nursing on a global basis, Ushaji?
See, future of the nurses, there is a lot of opportunity. I'm very, very optimistic. There is a future is very bright. Nurses, everybody, I encourage all the young people to opt for the nursing and the monitoring of their sugars or their medications to be taken. It is a comprehensive in terms of progress of or better outcome of the patient. So the sky is limit. The nurses have got a very, very, very crucial role, and they can come out and so government is planned for a lot of nursing colleges to back up to generate more nurses and good curriculum. I am feeling very proud to be part of this noble profession and proud to be a nurse. I worked in UK, so I know the international and the national, and where we always follow with the help of Joint Commission and NABH, all the organizations follow a top-notch protocol-based nursing processes and clinical handoffs, safe nursing practices, makes the patient journey very, very safe and better outcomes. So thank you so much on this International Nurses Day, interacting with me, wishing all the nurses across the globe a very, very happy International Nurses Day.